Good afternoon. Hi, everyone. Hi, so welcome to the first lecture of this semester for the Global Scholars Lecture Series. My name is Brian Fleming from the Office of Global Engagement. We sponsor this series with the Office of International Students and Scholars, and we're very pleased today to have with us Dr. Jaqueline Calderón Hernández, who will be speaking to us today about building bridges between science and society, the environment and cancer in Mexican children. Before I introduce her a little bit further, however, I would like to remind you all about next week's event, which is entitled On Refugee Work in Afghanistan, an interview with Farhad Sharifi. It will be next Wednesday in this room, 4:30 p.m., and also live streamed. So now for our special guest this evening, we have with us tonight Dr. Jaqueline Calderón Hernández, who is an environmental epidemiologist and risk assessment professor from the Universidad Autónoma de San Luis Potosí in Mexico. While on sabbatical from her own home institution, she is here working with Dr. Philip Landrigan in the Global Public Health Program. Dr. Calderón is currently working on a project entitled Geographical Distribution of Environmental Risks, Social Determinants, and Their Contribution to the Global Burden of Acute Lymphocytic Leukemia in Mexico. For almost 3 decades, this type of cancer has been the leading cause of death from a non-communicable disease in children aged 5 to 18 years old in Mexico. Dr. Calderón's work uses the power of data to get answers, propose new hypotheses, and design local strategies arising from big data analysis towards the precision of public health to reach the people most in need. This project is part of a comprehensive research strategy focused on priority diseases in the Mexican population. We're very much looking forward to tonight's talk, so let's give a warm welcome to Dr. Calderón. Thank you.
Get off my mask.
Okay.
Okay. Okay, thank you, Brian, and thank you, the VC, for this opportunity to show some of the work that I have been developed in the last 5 years. But first, I want to thank to Dr. Phil Landrigan. Since February 2020, when I came here, I started to working on to developing this idea of this social digital lab. Our main interest was how to create an agenda focused on the prevention of cancer in children from Mexico, because this is the one leading cause of mortality for a specific age group. So I'm deeply grateful. I have been the opportunity that Dr. Landrigan have shared with me or his knowledge, and it has been a great opportunity to advance in this strategy. So today, here we have important words is science, society, Mexico, environment, and children, and cancer, of course. So I want to start first how I become a scientist interested in environment and health, and specifically on children. I start my career almost 30 years ago. And first I was focused on cognitive development and one specific pollutant that was arsenic and lead. And then I moved toward fluoride. But then I have included other social determinants in my research, like education level, poverty, and I have been moving for a more complex scenarios, and that's my work focus on cancer start just when I didn't have any money to do research. They were short of funds in Mexico. And then I decided to look into the data that already exist. And since 5 years ago, I have been working on data. So I just want to give this information to show that sometimes of course, we need to have financial for do research, but sometimes it doesn't need to be that something stop us. So Mexico is a diverse country. We have, in this slide, I want to show you that all color points are language that we have in Mexico. We have over 60 languages in all the country. Most of them are in the south part of Mexico. And I want to present this information here because when we want to work with the health population, we have to consider that we have this diversity. Also, we still been, even with this era where the sun and some other technologies for get power, we still being a country where the wood for cooking still a problem. This in the same areas, the red points are the highest proportion of municipalities where they use wood for cooking, and wood is this is an important pathway or a source of air pollutants. Of course, we are a mining country. The blue points are places where mining activities occur happening in Mexico. And of course, we have water contamination all along the country. And here in this map, I want to show where the at state level, where we have an excess of risk for leukemia in Mexico. It was the first map that we created with this data set that we got from the government. So there is no doubt that pollution is one of the most important cause of disease. There are 9 million of premature deaths that are the data from 2019. And the importance of this is that almost the highest proportion of these deaths happens in low and middle income countries. That fits to what Mexico is. Also, there are other economic losses at global level. So the pollution is something that we have to deal every day. It's worsening. And air, there is information that over 90% of people in the world is exposed to low quality air, and focus mainly with chemical pollution. So these are just some important points to keep in mind at global scale. However, I am interested to more local, more precision public health. And this is it's not a news information. This is an information that it was released like 10 years ago. And that what I want to show here is that there is nothing new that leukemia is associated with some environmental pollutants. The red arrows are, I want to, that you have your attention here in motor vehicle exhaust, also indoor air pollution, and exposure to pesticides. So it's something that we already know that happens. So the question is why we do not have strategies or an agenda focused on the prevention. So when we try to, I took this slide from the CDC because it represents very well what I want to express here. If we want to link the environmental pollutants with exposure, it's not a problem because there are biological markers or environmental markers that we can evaluate and analyze, and we can get it's possible that we have information, a clear picture about the levels of exposures in the environment or in what are the levels that people are exposed. But there is a huge gap when we try to link exposures with health effects. It's something that we need to work, something that we need to develop strategies, and that is what I want to show today. The traditionally work on environment and health has been addressed just focusing one single exposure pollutant. If you make a review of the published papers, it's almost a high proportion, like 80% or 85% of the documents are related with one or two pollutants. But when we talk about mixtures, that is what happened in reality, the information is is less that have been produced. So we live in this environmental complex situation every day. So we have problems related with health that we need to move to these innovative solutions. So we create, I have been working with these innovative solutions, trying to reduce this gap between exposure and health effects. And the other important point here is that sometimes specific pollutants or a mixture of pollutants have different effects. For example, in the case of indoor air pollution that is very common in Mexico, mainly in these rural areas where I present before, researchers are focused, or physicians are focused in analyze pulmonary function. But they are not interested if leukemia could be an early indicator, or if children are more susceptible to this exposure. So we need to also to identify more vulnerable populations or early indicators that something is happening with the health in the population. So of course, we need to look at individual, local, national, and international levels. And we need to work with this concept of the converged science, not just multidisciplinary approaches. We need to find innovative solutions working together on a specific situation. So the question here is if clustered cases of acute lymphoid leukemia in children and teenagers could be a sentinel indicator. Here I have the urban air pollution from multiple sources because it's the first information that I got a few months ago. But the information that I'm going to share here is that it will be a sentinel indicator to leukemia. Mexico is the main cause of death from cancer, leukemia. So we have these huge problems, right? So what was the idea that we have developed with this problem that we need to solve? So we are working on, we designed this social digital lab where the idea is that we need to involve everybody, not just the research or healthcare providers, the patients and community and non-NGO organizations are a key part in this partnership. Also, we need to generate information for set public policies based on data. So it's looked like something that sounds logic to have this integration, these sectors, but in reality, it does not exist. And in the case of Mexico, for example, healthcare providers, there is an organization that is not linked with environmental government organization. So also research is just conducted in a way that is a research that we are not focusing on, we are not have the final interest in have an impact in society. So this general concept is focused on in three first strategies is to integrate and maintain data sets with the objective to monitoring population health, but not just the population health, also the social indicators and environmental risk factors. I'm going to talk later about how we put together these social, health, and environment in order that we can present or have a more clear idea about the situation in Mexico. And the other point is that we need to work on this development of digital tools. If we want to have an early diagnosis, we need to integrate these strategies. The medicine, the precision medicine is something that has been a lot of budget, and the hospitals and some other people who work on research is focused on precision medicine. But few people is thinking in this public precision environmental public precision. So we are working on develop these digital tools. And also something that is really, really important is the educational resources, but with this integrated idea. So the first step that we follow here was to integrate these databases. In Mexico, we do not have a cancer register. Sometimes the registers only exist in a paper and in an office. So there are some advances in integrate information, but it's only focused for an specific cities and for specific health conditions. So the first step was try to integrate this information from all possible sources. The healthcare system in Mexico is fractionated. It means that we have 4 different healthcare providers, and all of them have different strategies. So it was our first task to integrate this information. The second was, here I have these sources of environmental pollutants. And also there is no data set where we can just go and get information. So we create and integrate these fixed sources from pesticides and from emissions in the fixed sources, also vehicle emissions. So we integrate a second block of information. And finally, something that is really, really important is the social determinants of health. Education, of course, the demographic characteristics of the population, different languages, or different, according to the ethnicity, is different how they communicate. But something that is really important is how the healthcare sector has been educated with when we talk about environment and disease. So we have identified that physicians, at least in Mexico, they are not trained with the focus of environmental medicine. So when we want to include the exposure, the environmental exposure into the relationship between health and signs and symptoms, it is not included. So it's another area that we have to develop resources to train physicians. So the first product that we have that we created was this Ciala. We have several universities in research. It's research action about leukemia and environment. So we have this web GIS solution where we can put together these data sets and calculate risk in specific areas at different geographic aggregation levels. So in Ciala Risk, we can create these maps. We can add some layers. It works like a GIS system. However, we are including this specific information, for example, the sources of environmental carcinogens, the medical facilities, and also the social risks. So we create this web GIS solution in order that we could visualize specifically where the cases are happening and where the environmental factors also are occurring. Sometimes, for example, the physicians, when they want to check quickly how the disease is distributed, they need to contact someone who is an expert in geohealth or who is an expert in GIS. So we want to use, or that people use this tool that can be that everybody can be used. They don't need to be an expert to visualize and analyze the information. So here we have different levels of aggregation from the state level, from local level, from geographic AHEP, that is our smallest geographic area. And also we can identify where the cases are clustered and which municipalities are the municipalities that are having a clustered cases. It was the first element that we included in this research. It was our first product. Now we have been working with 2 states, San Luis Potosí and Zacatecas, and more states are being adding. They are sending their databases because they want to learn with this and to include these strategies in the healthcare system. So the second situation that we have here is that usually when a history is medical history is taken in the information about environment is not included. I'm talking here about individual level. So we are working on this electronic pediatric environmental history. The idea is that in addition to traditional signs and symptoms, we add information about where the child lives, if there is a risk, environmental risk in the area, if there is an excess of cases of cancer in this case, and that this information can be added as an additional indicator, as an additional vital thing in this, in order to identify cases and reduce the time when the children receive the medical attention. One of the important information here is that in Mexico, sometimes children can spend until 3-4 months until they have the correct diagnosis and when they get the medical attention. This is important. Time is an important point when we talk about leukemia, because if the treatment starts earlier, the possibilities, the survival also increases. In Mexico, the survival for leukemia or for cancer in children is only the 50%, compared with other countries where the survival rate is over 90. It's a condition that can be prevented, and if the children children can be recovered from the disease if it is treated in early stage of the disease. So we have a problem, and we try to solve with this strategy, with this pediatric environmental history. The important here is that if we know where the children live and we know what environmental exposures are in the environment, instead of just identify, it's common that a child goes to see the physician, the pediatrician, and the child go back to her or her house with a Tylenol. But the time when finally the children is really, really sick, the important time, we lost this window. So that's the second solution that we are working on, this environmental pediatric history. But the important is that we need to have information about what toxics are in the environment. And the information about toxins is not everywhere. So we have to integrate in these specific data sets. So also, this is at the individual level. We are trying also to work on these pathways of medical attention. It's something like the Uber of the medical attention. So once that when we included in these high clustered areas of acute leukemia, and we move to these areas to do more active surveillance, it's possible to identify children in early stage of the disease. So we are working on this strategy in a digital platform in order that we have information about medical services and where is the closest service where the child can be attended, and also to have a bridge between primary and the tertiary level, where the diagnosis finally is done. So this is I call these pathways of medical attention because of time is an important point. And the other important point is that children can be spend a lot of time trying to find the right service, the right healthcare service, and it's something that we need to work on. It's something that the healthcare system need to work, and we are providing with this solution. So the other important point is that we have these surveys for the medical practice, and when we ask about environmental risk factors, if they get information in the medical history, they ask some questions, are general questions like cigarette smoke, because everybody knows that cigarette is associated with cancer. But cancer are different kinds and different types. And when we talk about cancer in children, yes, cigarette smoke is an important factor, but we have other, like pesticides, like exposure in the working areas, like solvents, or exposures during pregnancy. But most of the people, most of the physicians, healthcare providers, they just think in general, radiation, sun exposure, cigarette smoke, pesticides in general, but not specific. And if we have this information from the geographic information, where the children live, what are the toxins that are surrounded in their environment, it's easily to identify specific substances that can be increase the risk of leukemia. So this is something that we need to work also, because sometimes we have this general information, but we need more specific information. And also, this data are from Mexico, the medical perception. This is something really interesting, because when we ask about the genetic factors, almost a high proportion, like almost 100%, they say that genetic factors are the main cause. But in the literature, the information is that only 10% in the case of leukemia, only 10% of cases are can be explained by genetic factors. And then they say, well, okay, environmental pollution. But environmental pollutions can be anything, from air, from water, and other proportion, they say virus or bacteria, and that's okay, and also the poverty. But in general, the perception that healthcare practitioners have about environment and childhood cancer is unspecific. That is why we need to work on to create resources, medical resources, to train the young physicians, the young researchers with these wide but specific about the environment. I don't know if you have any questions. We're going to leave the questions to the end, until the end. Okay. This is just a map. This is the city where I live. This is San Luis Potosí. And when I put in this, the red dots are cluster for leukemia, acute ALL. But when I request, I'm a postdoc student that included all types of cancer, I really was surprised about what we have in the city. Looks like a mining area, right? Because at the beginning, we were only interested in leukemia, but then there are other types of cancer, like lymphoma de Hodgkin or acute myeloid leukemia, that also can be associated with environmental exposure. So that's the map of the cancer in a medium-sized city, where I'm going to go back. This is not a map, this is just a figure, but I want to show here is that the red points, probably is not a good resolution, but we have here the red points are the cases of leukemia. And the green and amarillo, sorry, yellow. The green and yellow triangles are places where there is a physician. So this is like primary healthcare walk-ins. So the first thing that I saw here is that, for example, here there are some cases of leukemia. But also there are many places where the child can get the attention, the medical attention. So the point, it's something that is telling me that probably the physicians are not trained to identify cancer in the early stages. So we need to work on that. That is one of the bridges that we are constructing with this work. So I'm sorry for my English. It's just, okay, the other strategy that we need to develop here is that to develop these resources, but it has to be culturally relevant, and we need to develop communication strategies that really goes directly to the people. So we need to develop this material for health education campaigns for the general public, but something that is really important when we talk in cancer in children is that we need bring these younger voices into this environmental health and conversation. So it's something really, really important that we have left aside, but they need to be included. So I have been thinking some strategies with this era of technology. I don't know, probably a video game. Probably video game, and how they can reconstruct their risk in their environment. So the technology can help us a lot in order that we can identify these risky environments. And also, if they identify the risky environments, they will be able to find ways to protect themselves, or the pressure for the government could be increased. So the conclusions is that prevention, the reduction of the exposure is possible in the case of environmental carcinogens. The early detection also, it's possible if we have the specific tools. We need to continue monitoring the population health with these different eyes, with an open eyes. And also, it's really important, communicate effectively, inform, and this is educate. It's the culture of health. Educate not just the people, also educate physicians, educate researchers, and educate politicians. So something, and in addition, is these partnerships between communities, between researchers, and between healthcare system. So we need to build strong bridges. Thank you. There is time for questions? Okay. Thank you. Yes.
First, I want to thank you for doing research in Mexico. I'm Mexican too, and it's a little frustrating to see how research about things that really matter are not centered in Mexico. On top of that, I want to ask, in a place where being an environmentalist that really cares about the environment is one of the most dangerous things to do, how would you encourage people to actually care in an environment where you're a political activist is a really dangerous thing?
Yes. Yes.
How would you encourage that to people and to move politicians to actually?
Okay. Yes. It's when we talk about health, always there is economic situations involved, but also there are political interests. So, for example, in the same city where I have been working and living for almost all my life, there was a huge pollution plant with arsenic and lead. And when I asked them why, if you know that lead and arsenic are toxic to the people from the owners of the place, they say, well, it's just that we don't have regulations. And if we don't have regulations, we have the right to release any kind of toxicants that we want. So it's not complicated, but also the evidence that has been for the research evidence sometimes is not enough strong to have enough pressure to make these changes. Yes, thank you.
So you don't have any regulations for these exposures?
There are some regulations, but for example, the old lead exposure, it's something that everybody knows. That in ancient times, the Romans, they already know that lead is a neurotoxic. And until 2 or 3 years ago, they just initiate on how to look about lead. But even when they measure lead, there is not a strategy of communication. If they identify children with high levels, what are the strategies that we need to follow? So it's the norm, but it's not something that we have how to act. It's frustrating not to have, because we produce and we generate many data, and sometimes if I saw 25 micrograms per deciliter, it means for me something that is really getting damage in a brain of a children. So we don't have these strategies. What we have to do, communicate effectively about the risk.
Following up on that excellent question, I'm regularly shocked about the killing of journalists in Mexico just again yesterday.
Yes.
And it's investigative journalists, often to do with the drug kind of dealing, etc. But I mean, being investigative in terms of environmental pollution and health effects
Right.
probably puts a researcher in a similar dangerous spot.
Yes.
How do you see that from your kind of inside expertise? Do you feel
It's dangerous. For example, 2 or 3 days ago, a journalist sent a message to me and told me, send me the evidence. And I say, well, first, what evidence do you want? It's not cancer evidence. It was related with renal disease. And he told me, send me the evidence because you identify the high-risk areas. But in the way how the information is released is also dangerous because the context where they put all this information is something that I say, okay, no, talk to me. What do you want to, what, where, and when? And finally, he didn't contact me again because I'm not this kind of person and I am just going to release the information. So now that the good news is that the government, this project, and now have the attention to the government, the people who put the money for doing research. And today I have a meeting in a few, in 1:45 minutes with them. Now we have received a lot of attention, this strategy that we are developing. So it's something that is new. And we expect that from the higher levels in Mexico, from the government, we could have more pressure on everything. And of course, trying to be careful. But it's something that we need to do. We need to release information, but we need to be responsible with the information that we release. Yes. Jim, I don't know how the strategy, Jim. Yeah.
Thank you for your presentation. I'm curious about comparison. I'm thinking, this is your work on Mexico. The challenges you have must repeat themselves elsewhere in the world.
Yes.
And I'm just curious, when you're doing this, when you're setting up these strategies, do you ever look horizontally across the world and say, what are other places that I would like to use as reference points as I develop these strategies?
Okay, yes. It's something really interesting question because I read always. And for example, I just attended a webinar 2 weeks ago from National Academy of Medicine. And these points that probably I wasn't able to release correctly, but something that I have been thinking in the ways how this can be conducted, they are putting that are important points that we need to conduct. So in my experience, the information is disaggregated and it's everywhere. For example, in the US, there is the pediatric environmental units, but I think probably nobody knows that. For example, I don't know, for example, for Massachusetts, kindergarten children are requested that they have a blood lead test. I don't know what happened once they have this information. I assume that there is a strategy to reduce levels and to make a follow-up. But in other countries, for example, the information that Kurt shared with me I don't remember the name, but in this corridor in Louisiana and in Texas, when they have this cancer corridor, there are this petrochemical industry, and why there are cancer there? It's the main indicator is that people is dying from a disease that is related with the environment. So the answer to this question is that probably we haven't done enough, almost everywhere in the world. And of course, there are more disadvantages places like Mexico, Central America, South America, or some places in Africa. But we need to move. It's not like really, really expensive. It's something that we can do.
Yeah, it just strikes me that that it's one thing to say we have to address this here in Mexico. It's another when you say that it's pervasive, and then that you have people like yourself who do in-depth local studies. It just strikes me that we should be seeing more in-depth local studies used comparatively so that we get best practices, right strategies,
Yes.
good networking, better communication,
Yes.
better reporting.
Yes.
I guess I'm concerned about how singular this is and how where the comparatives are. That just strikes me as at least the next step.
Yes, I think this, well, I don't know if I understand well, but I'm going to try to give an answer. I think this strategy can be set the basis for this tracking environment and health system. And we can add any kind of disease, any. So I don't know why in my presentation I don't have where do we have to start. For example, which disease is the disease that is most important for a specific area? Not for a country, probably for a specific municipality or for a specific small community, because it's very common that people, they have their own concerns and they say, oh, we have a lot of breast cancer in this community. And there is no any mechanism that they can do something. So also, we have a lot of cases of autism in another area. But this strategy can be tailored and can be used. That is why we want to develop this GIS web system that anyone who wants just to put data can have a picture about what's going on in a specific area.
Can I just ask a final specific question? Are there other places in the world that have this leukemia issue that you're addressing? Just for an example.
Okay.
My niece died of leukemia.
Okay. Okay.
So I'm very connected to leukemia. And I'm just curious.
Okay. Mexico is the country where more kids die from leukemia all around the world. So the incidence rates compared in other parts of the world is like Mexico is like 3 or 4 times higher. So the main problem, for example, in the US, they have in California a group who works topics about leukemia, but the problem is not in the magnitude that we have in Mexico. It's yes, it's not the magnitude. I don't know. I have some hypotheses. I was thinking that, for example, we use corn, tortilla every day, and there is a fungus. So sometimes cancer and virus have this relationship that when we found a virus and the environment toxin, the risk increased like 10 times. So
groundbreaking the work you're doing. I imagine there are other groundbreakers around the world.
Yes, yes. Okay, yes, this is a global level and state level or national level. But it's probably that in specific communities somewhere in the world, they are dealing with leukemia. Maybe around, I don't know, maybe around a power plant, maybe around a place where something is born. This brick cleans, yeah, now I have an answer. It's something more related with epidemiology methods, environmental epidemiology methodologies that we have following. And when we talk about cancer, we need a huge sample size in order to have enough power to have this statistical significance. And because you can see here are 5 cases, 10 cases, and for example, in the city of San Luis Potosí, 90% of cases are close to an environmental pollution source. So it's probably that in other parts of the world happen, but we have not addressed and we have not seen specifically with this disaggregated level. And because the data are just comparisons between countries. the IHME, we can make comparisons between countries, but not in specific areas. That is why the precision public health is something important that we need to move forward in order to identify these underserved populations, and they have specific needs. Yes. Okay. Yeah. Yes.
So you talked about the importance of like communicating and like having people understand like the causes of cancer, and also like the gap between the actual causes of cancer and like public perception. So what do you think can be done about communicating like the causes of cancer, and also like how could we deal with like distrust in science and getting people actually like on board?
Okay, this is a really difficult question because there is not only one answer. So I think that people have the right to know first. And when we talk about environmental pollutants, there are something that I can control, I'm as a person. But there are others that I can't. But I can have the power in the society to give some pressure. For example, air pollution is something that I'm thinking how I'm going to prevent from air pollution. If we are talking about water, it's relatively not complicated to prevent from these, from pollutants from water. But air is really, really something complex. But there are, for example, strategies. We can just keep clean our house because some PM 2.5 particles stay in the house and just move around the house. So it's a simple strategy, but we need to communicate, and people have to be informed, and also to offer some solutions and alternatives. What you can do since you're in your position. There are some measures that can be done by yourself and others that need to be done by the government. Yes, that's what I think about this. Yeah, but the people have the right to know. For example, here in Massachusetts, I was concerned about fluoride in drinking water. But then I found information about that there are more in drinking water, more than fluoride. So it's something that I say, wow, why? Why? We have these radon in water, other substances. And I would like that somebody told me before I decided to, I don't drink tap water, but sometimes I say, well, I don't have water, filtered water, what I'm going to do? I finally use the tap water. But I assuming that I'm reducing my risk if I only make once. Yes, but there are other, we need to communicate. For example, people think that if you boil water, you can kill everything. But in the case of pollutants, chemical pollutants, it doesn't happen. It goes twice if you boil the water. So are simple strategies that you can follow in order to protect people. Yes. Yes.
So I was wondering how the building of the main train that the president is hosting in Mexico is going to affect the area, specifically, like Oaxaca, all that area that you had highlighted with cancer. Because like some people just think that it's the environmental factors that this train will be affecting and it's bringing tourism, but I'm thinking more like disease-wise. What do you think?
Okay, just 2 weeks ago we included Oaxaca in our strategy. And the meeting that I'm going to have later today is to prepare the strategy that we are going to present to the president to bring the attention to this problem. Yeah. So I hope that we will be successful trying to present all the facts and the strategies and offer possible solutions to this problem. Yeah.
Very nice talk again, and my general kind of priority is always primary prevention, and we also nicely talked about that, but there's many other elements to, as you nicely demonstrated, for cancer kind of care, and particularly for the ALL in children, we have at least the potential for a 90% and more cure rate, and it's lower in Mexico in some areas. What are the factors? Is it access to the health care? Is it by the socioeconomic status? Is it the general excellence of the treatment? Because I remember from my own time in oncology, the ALL treatment is one of the most complicated and longest treatments
Okay, there are several points. It's not just the healthcare system. It's my hypothesis is that when the children get the treatment, they go back to the same environment. So they remain in this area where it's highly polluted. And it's not just cancer pollutants, there are other pollutants like immunotoxicants that can just reduce their capability to respond. So they have a toxin from the drug for the treatment, and also they have another burden of environmental pollutants. So it's one of the examples that I always use is, for example, with asthma. Asthma, people know specifically what trigger the attacks, so they try to avoid. But in this case, that is why we need to inform people what you can do. 70% of people in Oaxaca are still using wood for cooking, and indoor air pollution is one of the factors that are associated with leukemia, and everybody knows that. So what we need to do? People, I'm sorry, it's just, okay, so one point is that they go back to their environment, and the other is also the treatment. As I say in the conversation, in this conversation, sometimes children go to the doctor, but it's the doctor that is in a pharmacy doctor, because it's really, really cheap. It's like $2 the consultation, but this physician is not well trained because signs and symptoms can be inspecific, and probably it just received a Tylenol, 3 days Tylenol doses, and the children do not improve. So I have a rule when health is, if the 3rd day you do not see an improvement, go and seek specific attention. But also, the other point is that we have different health systems, like services, IMSS, ISSSTE, Seguro Popular. So it's something that also is equity. It's not everybody receives the same healthcare attention. So it's a complex, but it's not impossible to offer solutions. Yes. Okay. So I don't know if there are any other questions. I really enjoy. Thank you for giving me this opportunity to share my work in Mexico. And really, I want to thank Dr. Figlandrigan, because at the beginning, when I decided to come to BC, I remember that he told me, what do you want to do? And the easiest answer is, well, I want to be involved in one of your projects. But now he told me, what do you want to do? And I say, well, I have this dream, I want to do this. And his generosity, sharing with me all his knowledge, has been something that is supporting something that I presented today. Okay, so thank you.